All right, we're gonna reconvene the meeting and we're ready to, hear the presentation of the Glades County School Board Cigna 2025 year in review.
Sure, John Millay, Director of Human Resources. Just want to introduce Tiffany Hill and join us Christine Higgs with Brown & Brown. We're going to give you an update on your insurance, the history, what we're going, and answer questions. I'm going to turn it over to Tiffany.
A little bit shorter,
Yes.
Just a little. I'll just test to make sure Christina can hear us. Christina, shout out if you can hear us, okay?
It's a bit muffled, but I can hear you.
Okay, so if we need to, just for audio purposes, when we get to the point where asking questions, if she can't hear, I'll be sure to translate to her and make sure she can hear. So I apologize, because it sounds like this was meant to be a little bit earlier, and I think I walked in like right after we were supposed to do it, so I appreciate you all, and honestly, the discussion and dialogue is fantastic. I would love to come to every board meeting, actually. I have school-age children, and I should come to more of my school district's meetings, so I appreciate the dialogue. But thank you nonetheless so much for carving out a bit of time in your board meeting to let me speak. And I'm also joined by my colleague Christina Higgs. I'll let her introduce herself in a moment. But my name is Tiffany Hill, as Dr. Millay mentioned. I've been a consultant for the school district since I believe December of last year, but you all have been a client of Brown & Brown since 2023. So I'm going to take you back through a little bit of the history of the engagement that we've had representing you all, acting as your consultative benefits broker. We're going to talk a little bit about what some of the renewals have looked like. I know that insurance is a very important topic, exciting topic at that, as well as I know everybody gets very excited when we start talking about insurance, but it's obviously a huge expenditure. And one of the most important things is evaluating on an annual basis, making sure that the plans that are in place are comprehensive, competitive enough that you're keeping employees and attracting employees, because it's obviously one of the biggest reasons why people either stay or go, or want to come initially, so we completely understand that. I also wanted to mention too, I work for Brown & Brown. Some of you may be familiar with Brown & Brown. We're the 5th largest insurance broker in the world now. We had a very large acquisition last year, acquiring a company called Winter Risk Strategies, which included a group called Garen Group, based out of Palm Beach Gardens. Some of you may know them. I bring them up because they are, they've always been a competitor of ours, and now we are all working as one big team, which is fantastic. And I say that to say that they really are the only other agency that I can think of in the state of Florida that does as much government entity, bless you, insurance work as we do. My office solely writes property and casualty as well as employee benefits insurance for government entities in the state of Florida. It is our specialty. The service and marketing team that reports up to me, all they do, live, breathe government entities. So we have lots of school districts, we have lots of counties, we have lots of villages, towns, special districts, the list goes on. So right now we are representing more than 400 government entities in the state of Florida with our insurance, whether it's property and casualty or employee benefits. So very familiar with this space. I worked for Brown & Brown now for going on 12 years. Prior to that, my background is in human resources, so in totality I have almost 19 years of human resources and employee benefits programming under my belt. And so I just wanted to quickly introduce myself for those of you I haven't had the opportunity to meet with. I'm really looking forward to going through this deck because it's a mix of providing some insight, a bit of a looking glass into how claims performed last year, how the plans with Cigna performed. Also some education, because your plans with Cigna are what we call level funded. And I think at first, your first time hearing that, you think, does that mean self-insured? And it doesn't. So I want to talk a little bit about the differences between some of the funding models that you have access to and why ultimately I think it was a good move for the district to move to level funded programming with Cigna. The plans are doing fantastic thus far. I know we're only 3 months into the year, but Christina's going to give us some insight into some of the financial pieces of what it's looking like through this first quarter of 2026. So I'm going to kick things off. Do we have the presentation shared, or are you guys just back using your decks?
They have it done.
Okay, perfect. All right, so we'll just go ahead and do that. That's fine.
Would you like to?
It's on there already,
Oh, is it all on your screens?
No, it's on the board under where the Chrome is.
Oh, okay, if you guys are fine with this, I'll just go through the deck and Christina can show the deck as well. So, Thank you.
It's right in there.
my apologies for the technology. So flipping to the agenda, so I mentioned, I wanna just take you quickly through the Brown Run history. I'd like to do just a quick simplification of what it is to be level funded and what that looks like in terms of contrasting and comparing to self-insurance and being fully insured. And then I'm gonna turn it over to Christina to talk a little bit about the CAP report, which is your consultative analytics report. We had an opportunity to sit down with your HR team with Cigna and kind of go through that, and Dr. Malay and Linda both agreed it makes sense for you all to hear some of those highlights as they're really important. And then we'll end by talking a little bit about the year-to-date financial reporting that some of our proprietary tools that we have in place allow us to create some really slick visuals so that you can easily have a pulse check on what the financials look like with the plan. So before we kick things off, Christina, I'll allow you to go ahead and I didn't want to forget you, but go ahead and introduce yourself.
Sure, I've been with Brown & Brown for 8 years now. I'm a senior employee benefits financial consultant. It's a mouthful. But basically, my job is to take the health plan claims, save you guys the time and the effort and turn them into insights and things that we can actually use and things that make sense, so that we can get a good read on how the members are utilizing the plan. In addition to taking a look at the claims, I help a ton with the financials. And so that includes monthly financial tracking, as well as when it comes time to renew the plan, I'll be underwriting and providing projections and consulting on some strategy to see what we would like to do to keep the costs low or where they are, or any investments we want to make in the health plan. And so truly work as a resource here for you all related to both the claims data and the financial piece.
Perfect, thank you. So we'll go ahead and kick things off with the Brown & Brown history, which is it looks like slide number 4. So Brown & Brown became the agent to the school district September 1st, 2023. At the time, the district had Florida Blue plans, fully insured Florida Blue plans. Again, we're gonna talk about what that actually means. So immediately, as soon as we took over as agent of record, we raced as quickly as we could because that was right in alignment with when renewals are coming out for any 1/1 affected groups, which you all have an effective date of 1/1. So we went out to market on the district's behalf and we actually solicited proposals from multiple carriers. So you'll see here on the slide that we, obtained proposals from your incumbent carrier, which was Florida Blue. We received, a proposal from Cigna, who you're now with. We also obtained a quote with our proprietary healthcare consortium. We actually have a consortium that no other broker can put groups into. It's kind of like a pool or a trust, if you will. And it's just for Florida Government Healthcare Solutions, and it can actually go down to 30 lives. So a lot of times, small groups like that cannot be self-insured. Our consortium does allow for really small groups to still enjoy the benefits of being self-insured amongst, a shared risk pool. And then we also went out to NHC. So Florida Blue initially proposed an 8.5% increase. This was for the plan year 2024. Cigna actually proposed a rate decrease that would have totaled about $121K in savings, and then the other competitors were just not competitive. So we're kind of left with the Florida Blue and the Cigna options there, and ultimately for 2024, the district chose to remain with Florida Blue. So we then continued to negotiate. I think we did a few plan tweaks as well too, that just were able to shift some of the costs. We were able to get that 8.5% increase down to a 0.6% increase. So again, that's just reflective of our negotiating power because we have such strong partnerships with all of our carriers. So that represented about $13,000 in increase. So I only point that out because that's a huge difference to go from an 8.5% renewal to then bring it down to 0.6% is huge. So we felt successful in that. So going into the 2025 plan year, all the marketing for that, and when I say marketing, just to clarify that, I think sometimes us insurance people will throw jargon around, and marketing could be considered like things that you see on the wall to try and advertise. For us, in our space, marketing is basically obtaining our clients' demographic information through a census, obtaining the plan documents, the premiums that you pay for those plans, and we're putting together an entire spreadsheet that gets sent out to all of the carrier partners. And then they send us proposals back with quotes, essentially. So that's what our marketing team does. So for 2025, again, looked at, taking the plans to market. The initial renewal from Florida Blue for 2025 was a 7.2% increase, which they later revised to flat because we showed them that we had some very competitive pricing. And that's sometimes why we execute that kind of exercise, because we need to make it known to the incumbent carrier that if you don't wanna play the game, we have other carrier partners that might, play harder than you. So sometimes we'll obtain quoting and then go back and say, hey, we've got some competitive things, we can get the renewal down even deeper. So for 2025, which is when you all ultimately decided to move to Cigna, Cigna submitted a highly competitive proposal. It included some very key things. Number one, a 10% decrease in rate. For those of you that deal with insurance on a regular basis, we are not seeing decreases. We are seeing increases on not only renewals, but also the cost. Christina's gonna talk about like cost per service, cost per procedure, cost per script. Everything is on the up. There's not a lot of things that are on the decline right now. So they proposed a 10% rate decrease, which equated to approximately $232,000 in savings, along with a $25,000 wellness fund, which the district also has this year too. And we have already made plans to exhaust those funds in whatever way we want to. So what that fund is a pot of money that Cigna just says, here you go. Figure out, along with your consultant and the help of our engagement specialist, how you can keep your populations as healthy as possible. Maybe you do incentives for the employees to do certain health changes and you reward them with these funds. Or maybe we're gonna do a wellness day where we offer healthy lunch and healthy breakfast. That $25,000 can be used in whichever way we feel like it's appropriate to use, as long as it's in the spirit of trying to keep or make the population healthier in an effort to contain costs, essentially. A $10,000 technology fund, as well as a second year of 14% rate cap. Rate caps, we don't really see those either. So Cigna really came in strong, wanting to show their commitment to wanting to partner with the district on a long-term basis. That's why they said, hey, we're not trying to buy your business. In year two, we're actually saying that we will not provide you with anything higher than a 14% increase, regardless of how your claims are. So very, enticing offer, and ultimately, the district made the decision to move to Cigna.
Oh, what I was gonna share was,
Yeah.
well, it has your cap when when you purchased, I wasn't here, but you've got a really good price this past year. So when it was well below 10% of the other carriers, so now even if it goes up this second year, you're really in line with where everybody else was last year. So she's gonna talk about it. So,
Well, is the 14% gonna be an increase of what you came in on? That was $121,000 cheaper?
So the 14% increase came in 2026. But that is, and I'll explain why, there's reasons why the 14% came in. If everybody's okay with it, I will shift into 2026 naturally, so, a lot of times carriers will also show us what the uncapped renewals would be too, like that was a 14% cap. We have some groups in our consortium where the cap is set at 25% on an annual basis. And our carriers will show us this should have been a 50% renewal based on how things are running. So when we see caps, we kind of jump on them because carriers don't want to cap it. It's not in their best interest to cap it, especially when we don't know what claims go with each person. New people coming onto the plan, the way we view it is not to sound like we don't view everybody as people, but we view them as belly buttons, and each belly button comes with their own set of claims, and we have no idea what those claims look like. When people are jumping on and off their plans, it's very unknown, and there's a lot of risk there. So shifting into 2026, we ended up getting that 14% down to 11%. So initially they started at the 14% cap, and the things that made up the 14% cap, very important, this is probably the biggest part of it. In year one, being level funded with Cigna, you have to fund what's called terminal funding. Terminal funding is basically a pot of money that is set aside in the event you decide to move from Cigna. And that's to cover something called claims lag. And we've all been to the doctor before, we know that a claim gets generated when we go to the doctor. By the time that claim is actually fully processed and paid for, it could be 3 months since that takes service, right? So if you all decide to leave Cigna, you're gonna have this group of claims that really hasn't been paid for, and you're gone, and you're long gone, and you're with your carrier, well, those claims are still trickling in. So it is essential and it's a protection for the district to fund the terminal funds in the first year to cover in essence, if you were to ever leave. So if you ever leave, you don't have to worry about run-out costs or buying additional coverage to cover those run-out costs. The terminal funds are gonna cover that. So that's why a lot of people, when they're getting that first renewal, they're going, wait, this is a little bit higher. It is higher because first year you have to find your terminal funding. So the 14% was made up of terminal funding. It was also influenced by high utilization of unbilled claims. When we looked at your claims last year, there's a lot of people using the plan, a lot. There's also a lot of chronic conditions on the plan. And that's okay, because those are being, monitored. People are taking care of those chronic conditions, which we like. We don't want people to not go to the doctor if they have chronic conditions. We don't want them to not take those medications that they need to live, a normal, healthy life. And so it's okay. People are using the plans wisely. We have some, things that we know. We took takeaways from the CAP report discussion that we had. But overall, Christina's probably gonna tell you that there's really great news in what we see in the data. So, but for that first year, there definitely was high utilization of unbilled claims. There's a lot of people using the plan throughout the year. Additionally, there's medical trend that carriers are gonna factor in when they're talking about renewals. Cigna typically uses anywhere between a 10 and a 12% trend. So what makes up trend? Things that make up trend are these ongoing hospital system negotiations with providers. You see in the news, you see these hospitals fighting back and forth with insurance carriers. No, we're not gonna renew the contract. Yes, we're going to. And they have a hard time coming to agreement. That sort of turmoil, the constant necessity to pay our healthcare providers more for the services they provide, increased labor costs. Also, the increased utilization of GLP-1s. We'll talk a little bit about GLP-1s a little bit later. But there's a lot of new treatments coming on the market, like those kind of cause gene and cell therapies, biosimilars. All of those things contribute to whatever the carrier decides to use for trend. And most carriers are using anywhere between 10 and 12%. That's the norm right now. So that means even if you're, running an expected, 100 to 105%, you still could have some trend factored into your renewal. And that's really to just combat healthcare inflation, if you will. So we're 3 months into 2026. We have 12 months of data now with Cigna, hence why we thought it was important to go over those 12 months of data with you. The first 12 months, until that year has lapsed, we would consider that to be immature. Now we can consider it mature. We can now start looking, backwards and looking at trends. It's hard for us to do that in the first year because there's really no history to go off of with that carrier. We can look at your Florida Blue history, but Christina can make mention of why we're really just taking a peek at the CAP report and looking at financials for right now. So if there's no other questions on the history, I just wanted to level set and talk about how we got to where we are right now. We're currently level funded with Cigna, and now we're gonna just go into, you wanna get to slide number 7, I'm sorry. Yeah. So now I just wanted to take a few minutes to level set on some, an opportunity I have to educate you on the different, types of funding arrangements that we work in. So all the way over to the right, in essence, this slide is basically going to show you the continuum of funding options and really how risk is kind of shared between the district and the carrier. So on the right, you've got fully insured plans that are really offering the most predictability, right? So if you're really worried about cash flow and stability and budget, fully insured is the easiest. There's no fluctuations in how much you have to put into a claim fund. It's the rates are the rates. Employee only is this, employee spouse is this, and so on and so forth. And as people come off the plan and onto the plan, that's the only kind of shifting you're gonna see on the invoices. So it's very stable from a premium standpoint, minimal risk, but the downside is you have very limited transparency to what's creating costs that drive the premium. And there's also no opportunity for savings. So remember, if you remember, Cigna had proposed a mandatory 1% surplus, which would have been paid out, I believe, last month. No surplus can ever be offered in a fully insured space. It doesn't exist. So you pay it, if you have a great year, all that fat that's in the premium just goes straight to the carrier. So even if you've overfunded for paying for your claims, it's not like you get any of that back. So that's fully insured.
Fully insured is where the board, the district has always been
Yes,
until this year.
yes. Until 2025, the first year was Cigna. It's the first year that you haven't been fully insured.
last year, the presentation that Kate gave, there was no other option, like that option that we received. We would have been foolish not to have gone with that, like it would have been so much more on our employees that it wouldn't have been sustainable.
You're saying it was a no-brainer to move to Cigna? Yeah. They did give a extremely competitive offer. It's really hard to say, you know, here's an increase with your current carrier, here's a decrease with Cigna. And the reason why I wanted to call this out is because there's two main things that make the level funded program a better option for a group like you. You know, you're in a space number of employees wise where I wouldn't suggest to go self-insured, which is all the way over the left. The farther you go left, the higher the risk. But with that risk comes more transparency, more control, financial opportunity to gain back. The level funded center part is a nice happy medium. You don't have to worry about the max exposure that you have when you're self-insured. So it lowers the risk, that's why it's right in the middle, it's, you know, a little bit more risky. But when you get your renewals are much more based on your claims, not the entire pool or book of business like the fully insured spaces. So when you get your renewals, it's a little bit easier for us as the consultant to say, your renewal is this because of this. We can look at your data. We can look at your, you know, your financial, all of the financial insights that are available to us to make more sense of it. And that puts you a little bit closer to the driver's seat. I say self-insured, you're the driver. Level funded, you're in the passenger seat, you're in the front. Fully insured, you're way in the back. You're taking the back seat. And that's really how it works. So no surplus, you'll never get surplus. Level funded, you all are currently slated 3 months in, only 3 months in, so this is very mature, but you're currently slated at a cumulative surplus of just under 60,000. That's a 50-50 share, so you receive half of that. And that's also dependent on, you know, how much cert's coming out of the cleaning fund, of course, as well too. So as the year continues, I'll continue to keep you posted on what is that surplus looking like? Is there going to be a surplus? Where you were before, that's not even a conversation. We have no data, we have no surplus, we can't really do much about any of those chronic conditions we find out about. How do we know that we wanna put effort into incentivizing preventive care or incentivizing somebody to go get their mammograms done on a regular basis? How do we know if there's musculoskeletal issues, which Christina's gonna bring up later? We can't really strategically program if we can't see what's going on in the plan. So we can for sure in the level funded program. It's just that we don't have to worry about, in the self-insured space, you could be paying, you know, $85,000 one week and $30,000 another because your claims are just all over the place. So there's much more stability in the way that you pay and fund your claims in the level funded space versus the self-insured space. So, yes, question?
So we were in a meeting last week,
Yes.
or the week before, and they said, are you self-insured? And some of us in the room said yes, and some of us were like, no. And I don't even remember this being explained to us last year, that I didn't realize that we were in this hybrid, which is how I would define what you're saying. As a board, I don't know if I missed it in the presentation.
I don't remember it from last year.
Okay.
So it probably would have been presented to you in the fall of 2024.
It wasn't
Because-
presented, it wasn't presented, it was John got the presentation brought it to us. So yes.
Okay, got it.
That's why we didn't miss it, we just didn't get it.
You have my full commitment to do this on a very regular basis, as much as you need it to be. I feel very confident about the place that you're in, with the model that you all are using. I'm happy to have further conversations outside of this, you know, board meeting or at another meeting about, you know, some other solutions, but as it stands now, you're only in year 2 with Cigna, you know, I think it's in our best interest to see what this renewal looks like coming up. And you're running really well, so I feel, you know, pretty good about that so far. Any other questions about the funding arrangements?
Are we in a contract for the upcoming year already, or are we already obligated to go?
So every single
I
year,
thought we were in a 2-year.
nope,
Okay.
you're good. We can market it this year if you'd like to market it. We absolutely can. I have some clients that are like, you know what, just market it every year. We wanna see what's out there, and we're happy to do that. Absolutely. On the next slide, not to beat a dead horse, but this was a really great visual, just showing how when you're, paying on a monthly basis to Cigna, how you can actually see that there's multiple components in the total, right? So whereas on the right-hand side, we're fully insured, okay, thank you. Okay, perfect, thank you. So, you're also broken out into the administrative costs, we have to pay Cigna, so obviously do the administrative piece of this. The stop loss is already better with Cigna. When you're fully self-insured, you might have a separate stop loss carrier that's separate to your ASO or your medical carrier. And then obviously you've got a bucket for your claims, and then that potential savings is if you have a great year and you put way too much in your claim fund, Cigna says, here you go, you've got a great year to take some of it back. So that potential savings. Whereas on the right-hand side, it's just a non-refundable premium. That's what it is. You don't get it back. Great year, bad year, it doesn't matter. It's low risk, but honestly, it just does not provide the same level of control as you get when you're level funded. Again, another visual to this slide just really shows how, over the course of a year, how stable the outgoing in the fixed monthly premiums is. You can see January through December, it's stable across the board. So I mentioned this before, but I know something that's very important to some of our other school districts, and pretty much all of my clients, cash flow being stable and predictable from a budgeting standpoint is just, that's why that upside to being level funded, we always harp on, because I would love to make everybody self-insured because it really does allow the most control, but it doesn't make sense for everybody. Sometimes it will in the future after we've kind of gotten our training wheels with the level funded approach. But you can see obviously the right-hand side bar graphs are the two scenarios. So, in the first scenario, which is right here, this is basically just showing you that if actual claims are lower than expected, you get the surplus. And then in the second scenario, if the claims are higher than expected, then this is where your stop loss is gonna cover that overrun. So here we funded to here, but not enough. And so here is where that stop loss coverage is gonna come into play. And that's already embedded in your plans. You all don't have to worry about that. There's, things happening behind the scenes that are functioning to ensure that they're covering a lot of that risk there. So I'd say, in summary, it's like the level funded approach allows you to treat healthcare kind of more like a managed financial investment versus just like a sunken cost. You have a little bit more of that control there. So I think my next slide is really just in summary. You have this deck, so I won't bore you to death. I think we've kind of talked about, the upsides to it. Any other questions about the level funded model versus self-funded? If somebody asks you again, you can say, we're level funded, it's kind of like self-funded with training wheels, that's what I say. It's a nice in-between approach to, healthcare. If there's no other questions, I'm gonna turn it over to Christina and we're just gonna look at your 2025 analytics. And I'll drive for you, Christina.
Okay. Alright, so Cigna comes out and they do an amazing presentation, but I will be honest, it's like 40 pages long and there just has to be the nerdiest of appetite for data to sit through that for an hour and a half. It's tough.
I think
So what I like to do
that, so.
is pull up the main pieces and the most insightful pieces, get some bullet points down here and let you know what you need to know. Of course, we have provided the CAP report, we can provide it again, and I've reviewed the whole thing, so if there's any questions, I can answer them. But here are the highlights, more or less. I like to start with on page 12. I like to start with what are we looking for? What am I even trying to determine here? And really we're using this data to determine any cost drivers. And if there aren't any cost drivers, nothing that stands out, we're looking for opportunities. Is there any way in which we can enhance the plan or meet the needs of the members? And so my big questions there are, have there been any changes in enrollment? Sometimes we'll have a client who has doubled in size and didn't realize that meant double in size of claims as well and double in costs, and they're like, costs are skyrocketing, and we're saying, well, you doubled in size. So have there been any changes in enrollment? Are there any extreme catastrophic claimants? And these are claimants that are well above the stop loss deductible. So this would be like $1 million claimant. Of course, the client, you all, the district, wouldn't pay that full amount. You have a stop loss insurance in place with a specific limit so that you would never pay that. But it is important to know, do we have those on the plan? Or are there more kind of stop-loss range claimants than we anticipated? It's not uncommon for your high-cost claimant list for a few individuals, a handful of individuals, to drive upwards to 15, 20, even 30% of the total plan's costs. And so that's why we keep such a close eye on them. If there are things that come up that we can address, we will. But again, we do keep an eye on them because they can cost the plan a lot. And then the next one, what does the non-catastrophic spend look like? Meaning, okay, I get it, I've got these handful of people that are receiving some very costly care, but what does the rest of the population look like? Are claims going up for the rest of the population as well? And so we'll look at medical and pharmacy. For medical, I'm looking at, does the population have a lot of chronic conditions? Are they engaged in all of the programs that are offered? Are they reaching out? Are they doing their visits? And are there any J codes or infusion therapies, which are hitting a lot of the plans pretty hard because they're costly? In the pharmacy, we'll look at any specialty versus non-specialty spend, and we'll see if they are within categories that we can do something about and help keep those costs low. So I have to tell you before we even move on, school districts.
Morning.
Oh man, I looked at your specific population, it's 74% women. And so that's a great thing there, it's good risk because statistically and within the claim data, not personal opinion, but the women tend to get their annual visits more often. They get their blood work done more often. We're going in for the screenings. And also the research has shown that when there is a surgery or a health event, the aftercare is taken care of. So any school district tends to be pretty good risk. And I think that's one of the reasons Cigna has, wanted to play ball is because they know that as well. So on the next slide, page 13, just answering that question, has the enrollment changed? In 2025, which is what the data is in the blue, the Cigna CAP report wasn't updated through 2026, so I put a few bullet points to the side. In 2025, the average number of employees per month was about 221. That's gone down about 11% to about 197. Same decrease, about a 17% decrease in the number of members, so total people on the plan. If I look at this cost trend, the medical plan has about 1.2 million in spend, or the medical spend, the pharmacy was about 600,000. But because there's a little bit less in employees, what I like to use is the per member per month gauge. And that just means that I've taken the total cost for that amount and divided it by the people within the plan at that time. So this will answer the question of, are claims down because there's less people? Or is it actually that per person, there's less claim spend? And so we do see that from 2025 through the first few months of 2026, there is about a 17% decrease per person in medical spend, a 24% decrease in pharmacy spend, so overall about a 19% decrease. And then,
What was that timeline?
yeah, like I said, I'm sorry,
She said
bit
because
muffled.
of the decrease in enrollment, it was a decrease in enrollment, but we're also seeing a decrease in per member per month spend on both medical and pharmacy. So the cost, like if we're looking at per person, how much do you spend on medical, that's actually gone down.
In what time frame?
And that was January to March?
Yes, yep,
Yes.
through March, yep.
And then the last piece I'd like to pull out here is that non-catastrophic spend. So we talked about how, yes, we know there's going to be some members that have costly care, but on average, the rest of the population, how are we doing? It looks like a lot of that decreasing had a lot to do with not too many high-cost claimants on the plan just yet, or their claims not popping up just yet. The non-catastrophic spend, or everybody else, seems to be increasing slightly, about 2%. This is pretty normal. Like Tiffany talked about, we have medical trends, the medical trend close to 10%. I think within our underwriting, we're using about 8.5% for medical and 13 or pharmacy. So having this non-catastrophic spend up by 2% or so, very within range of what we would expect and actually pretty good. The next slide starts to talk about the chronic conditions. And so listed up towards the right, your chronic conditions are any of those conditions that are long lasting. So not something that can be treated and overcome in 3 months, let's say. They're long lasting and they require ongoing care. These members are not always your high cost claimants because their care might not be super costly within one period or within 1 year, but over time, their care will cost, and with an increase in the number of members with chronic conditions, we can see an increase in cost. So we do like to keep a pulse there. And on that very first line, chronic percent of population stood out to me. It says that in 2025, 53% of the population had a diagnosis of a chronic condition. Cigna's norm is about 32%, so this is a 21% increase over Cigna's norm. So my next question is, all right, we've got a population that has identified a lot of chronic conditions. Are they doing the right things? Are they taking care of themselves? Are we seeing the doctor, going to see those visits, going to do the screenings, taking the medications? And it looks like that's the case. So right underneath that, the chronic percent of cost. So Cigna's norm is about 74%, meaning of the total cost, claims related to chronic conditions, about 74% of the plan's costs, and for the district last year was about 71%. So making sense there. Underneath, very close in those preventative and wellness visits, and actually the next slide will show that a little bit more, but before we go there, on the bottom we have some pharmacy indicators. Generic dispensing rate will tell you of all of the prescriptions, what percentage of them were generics. But I like the next stat there, which is the generic substitution rate, and that is of all of the drugs that have a generic available, what percentage were taken the generic instead of the brand, and that is at 98%, so that's great. So we've got a good generic dispensing rate, a good generic substitution rate. Your specialty spend is below Cigna's norm. Non-specialty, a little bit higher there, but when I look at the current RX per member per month, we were down about 24%. So although 2025 showed non-specialty spend a bit above Cigna's norm, it looks like that has decreased in the first 3 months of the plan year.
There's already some positive things going on as a comparison to what's happening at the end of 2025, so.
Yeah. This next slide on 15 is compliance, wellness, and screenings. The district is the blue, Cigna's norm is the gray, and you can see your population, they're just rock stars. They're doing what they need to do, not only in pediatrics, which is very common. We see all of the pediatric visits because they need their shots and such, but adults as well are going to get all of their wellness visits, preventative care, and all of those with chronic conditions are quote unquote compliant based on what they should be doing to keep their chronic condition in check. The next slide is on specialty pharmacy. And two things here. First, on the right-hand side, you can see the biggest 75% of the pie there is for rheumatoid arthritis, psoriasis, and Crohn's. And these conditions are treated with drugs within the immunosuppressive or immunosuppressants drug category. And these are the drugs that are coming out with biosimilars. So to see that your specialty medications, most of them are within that category is sort of a good thing because we can do something about it. With you being level funded and sharing that surplus with Cigna, Cigna's got a little bit of skin in the game too. And so they're going to do their part within their formularies to make sure that if there is a biosimilar available, that's what the employee is taking unless it's medically necessary to take that brand immunosuppressant. So, good thing there. On the left-hand side, we've got pharmacy specialty drugs, but then we have specialty medications that are charged on the medical claim side. And these are any medications that have to be administered by a physician. So this would be something like chemo. And the
Infusion.
chemo,
She's gonna talk about the types of
We-
medications later.
I'm sorry, I couldn't hear that.
No, he was just mentioning like infusions, and I told there can be different kinds of administered infusions, which I think you're gonna mention in a few slides.
Yeah, just right here, that, between the gray and the blue, when you have the chemo and any of those infusions done in a home setting, it's much less expensive for the plan than in the hospital or even the outpatient cancer center settings. And the research is, new, but it's coming out to support the idea that those home infusions are actually better for the members receiving them, just in terms of comfort and being able to bounce back from those infusions and not having to get the rides and not having to have, the means in which to get there and home and settled and such. So I like to see that if there is infusion spent, that it's in the home setting versus that inpatient, outpatient, and that's what I'm seeing there.
Tiffany,
Yes.
this can be answered later if this is not the appropriate time. Because we're talking pharmacies. The customer, the patient doesn't always know when we go to the pharmacy, what the pharmacy's gonna tell you guys that the value of the product is. And some of us go to a mom and pop pharmacy because it's convenient and they look out for us, we're not just a number. But, if someone takes Glyzambi and I look online and it can be between $180 and $700. But I say I want to be the informed patient. How do I navigate that? And I don't know if this is the time, but we're talking pharmacy.
Yeah. There's a couple different, so are you saying that there's like a different brand than that?
No.
So the one you're talking about just costs in general?
Yeah, like Glyzambi.
Yeah.
There is no generic.
Right, it's the only one, yeah.
Right, but guess what? They charge different amounts in Publix, mom and pop, Walmart, and I don't want my district to be suckered, even though I'm paying the same amount, my $80, whatever.
Yeah.
So how does one, I take 12 medications, how does one navigate that?
Well, so one thing that we don't have in this deck, so maybe this can be a separate conversation, but Cigna has a really great concierge program. Christina, do you remember, it's escaping me right now, but I know it has the number 1 in it, and it's basically there's a chat version of it, and if you went to them and said, I have these 8 prescriptions, are you able to help me find the lowest cost options? Like, I've had people, I think I have a flyer for it.
I've used the concierge service,
Yeah.
because they reach out to me, I believe.
Yes, they do outreach.
But I did
programs
not
too.
know that was something.
Yes. You could talk to them about it too, but I tell people during open enrollment, listen, we all have to be advocates for ourselves now in this day and age. And I just have that RX, GoodRx app constantly open. I think, it sounds like you already are doing the due diligence ahead of time, and those are the mechanics, but the only thing I'd say maybe we can push a little bit more is the concierge and have Cigna do some of the work for us on that, especially if we have a large amount of prescriptions. And say, where can I go, here's my zip code, and they should be able to pull up, all of the places that you can get and see like maybe what the contracted rates are with those pharmacies. I don't know if you have anything to add to that, Christina? We were just-
No, you got it, just that the difference in the pharmacies is between the pharmacy contracts and those manufacturers.
It is.
So, Publix may be paying more for that drug than Walmart or Walgreens. And so that's why the member's costs or the patient's costs might not change because you're setting your co-pays, but you're right. The plan then will be charged a different amount.
Yes.
I don't take the district offered insurance because I'm old and I have Medicare.
Sure.
But, in response to Larry's question, my United Healthcare, my Medicare is through United Healthcare as a, Advantage, Medicare Advantage plan.
Advantage plan, yeah.
And I get a report, I get a thing in the mail, I probably should do it online and save the trees. But I get a report in the mail that shows every doctor's visit, every medication that I've gotten, and how much the doctor or the pharmacy claimed, how much they paid, and how much my share is. So you don't get that with Cigna, I'm assuming, or you wouldn't have that question.
I get it, I do with my doctor's visits.
So each carrier does that would be a good example of the explanation of benefits. And it sounds like what UHC is doing is they're just combining maybe in a range of dates. Like they might say, on a monthly basis, we're gonna combine all services, all prescriptions that were picked up, and we're gonna show you what the cost was, what the insurance paid, and what you paid. And so they might just be doing it in a combined effort. I know certain carriers, when you go onto the member portal, you can actually pull reporting, you can say like a date range. They might just be doing it more proactively, because maybe that's come up as a pain point, and people, voiced and said, hey, listen, we'd like for you to proactively just send this kind of stuff to us. But I can do some digging and see what, I believe Cigna has on the member portal, you can pull it on date ranges and things like that. It's just a matter of probably you being a bit more proactive. I think the EOBs are probably sent. I know I get my EOBs sent to me regularly. They're just not in a combined format. I don't know if yours are or not, but I think
Mine comes in
pull it.
usually every month, anything that I've had a claim for comes in.
Okay,
And it says what they paid, what they were charged, what they were paid, what my responsibility is.
in the CAP report, if you all have an opportunity and would like some light reading, I can't remember how many pages that is, but it talks about the how many people are actually enrolled on the MyCigna website. And it's actually decent. I wanna say it was around the norm, but we were like, we could probably, get that even deeper if we incentivized it. And that is, I know it sounds silly to incentivize it, but honestly, having people know where they can become informed is like half the battle sometimes. And I know, I have lots of clients in rural areas and they're like, we don't wanna use phones or we don't wanna use computers. So, I don't know that I should mention this yet, but there's plans for somebody to be on site from my team, just to sit and say, hey, register for the MyCigna app. Give me your phone, I can show you how to do it, or give me your laptop and I'll do it for you. We're well prepared to make sure that, my team's out here in person, making sure that even those little things help people feel a little bit more in the driver's seat and less, insurance is, I don't know how this works and I don't know what I'm paying for kind of thing. So, to get off on a tangent, but I wanted to share that as well too.
Big thing.
Sorry, Christina.
That's okay. I think I'm up to slide 17 here on the findings.
We're with you.
And it was just a quick summary saying enrollment decreased slightly. There weren't any high cost claimants last year to date, but we do have our stop loss in place for when they pop up. Non-catastrophic spend increasing a little bit. When we looked at the medical, we had a higher number of members with chronic conditions, but the members' cost is in line with the norm. The members are in compliance. They're doing their well visits, and then our specialty spend in home infusions is done in the home and not an inpatient outpatient. So really overall, good news, even on the pharmacy, specialty spend under the norm, and we have some immunosuppressive drugs that we can do some things about there. And then, non-specialty a little bit above the norm, but again, we'll keep an eye on it to see if there's anything else we can do. With your GLP-1 spend as a level funded group, you'll have the guardrails in place that Cigna has in place for level funded groups. When you're fully self-funded and you can kind of carve out, make any decision which way you want to, we do have some self-funded clients that are covering GLP-1s for weight loss. And so it's a big spend driver, of course, and we gotta make sure we have those guardrails in place. But here under level funding, with Cigna, they've taken care of that. So I'm not sure how we're doing on timing, but I can go very high level with the financial report, which is the next piece. This is the piece that the board will receive on a quarterly basis, just letting you know how claims are doing. Now, pages 19 and 20 are very similar, so we're gonna skip 19 and go to 20. Page 20 shows what page 19 has, but also compares it to the prior year, whereas page 19 is just those first 3 months in isolation. So I like page 20 a little bit better. So when I'm looking at how the plan is performing, we have a budgeted cost, a premium equivalent, or money going into the pot in that total amount, and then we've got our expenses, mainly the claims, medical and pharmacy claims, and then the fixed costs, everything to run the plan. So when I compare those two, the spend through the first 3 months of the plan year and the premium equivalent, we're at about at 87%, which is great. Included in that is about 207,000 in medical claims, 94 in RX, 105 in fixed costs, and you can see towards the bottom on the right, about 406,000 in plan costs. In the middle there, we've got no high cost claimants so far. Over on the left, we have our monthly plan costs against that green line, which is the budget or the premium equivalent. You can see we're below that so far, a little bit above it in January, but below for February, March. Underneath that, this is one of my favorite charts because the lighter blue is the plan costs in the prior year. The navy blue is the cumulative plan costs of the current year. So if I'm looking at March, I can see, okay, plan costs are slightly higher than they were last year. They're slightly higher than that lighter blue, but they're still below the budget that has been set, so they're still below that green line there. I think that's a good visual to sort of see how the plan is doing. The very next page has it in a table format, very line item, so you can see per month what the medical claims are, per month what the pharmacy claims are. And if you wanted to see per month how the plan ran as well, that's there. And the next page is by plan. A little bit of a caveat here. Whenever you have a buy-up plan, the buy-up plan is always going to quote unquote perform poorly. It's not that it's performing poorly. In a buy-up plan, we generally have a little bit of adverse selection. And that's across the board with every client, every health plan. And that's because members that know they're going to need care or that have long-term conditions, they're often going to buy up, right? They're going to take the richer plan with the better benefits because they know they're going to utilize it. So your highest utilizers will always be in your higher buy-up plan, which makes it look like every person in the buy-up plan is way more expensive than the people in the other plan. We want it this way because the buy-up plan has a higher contribution, right? So I have had some situations where maybe the client will say, well, what if we get rid of the buy-up plan? If we get rid of the buy-up plan, all of those members that know they're going to need care or that have long-term conditions, they're then going to be moved on to a base plan or the HSA plan where they're going to contribute less towards the overall plan. So the buy-up plan works for the reason that the member gets richer benefits, but they're also contributing a little bit more towards the cost of those benefits over time. And that's a caveat I like to say here because you will see it kind of stands out right away towards the bottom right that the members in the buy-up plan on average are more costly than the members in the other plan. The last two pages are your plan performance from 2025. So the overall plan performance, and we will include these on a quarterly basis. They're static now, it's not going to change now. But we include them in case you want to look back at how things were in the previous year or how things were by a certain time. It's important, especially in the finances, to be able to gauge those things. That last page is the high cost claimants. So those are the claimants that sort of made it onto our radar to see, are there shock claims? Is it something like maybe a dependent with a broken leg? We know that that most likely will be treated and all of the care and claims will be in about a 3-month period versus someone who has like breast cancer. You know, that's going to be a longer amount of time and more cost over time. So we start to monitor people when they hit this 62,000 range, just knowing that depending on their diagnosis, we may see more claims as they come in. So on a quarterly basis, you'll get this financial report. If there are any questions, once you receive it, you can call me, and if anyone wants to do a review of it, we can do an in-person meeting, an in-person review. I do think that claims tend to run a little, less claims in the few beginning months than later in the year. And even if I look at age 20 on the top left, I can see that the claims costs started to increase in the June, July, August, September range, and again towards the end of the year. This is also common with our school districts as people plan care and stuff over the summer. So they'll have some care done over the summer, and we'll start to get all those claims in July, August, September, a little bit of a spike there. So doing well so far, but we will keep an eye on things, and of course, I'm available, we're available, any questions on how we're doing, even on a month-to-month basis, if it's in between these reports and you'd like to see any of the figures that we have available, we can pull it for you. The good news, overall,
We like these kinds of meetings, actually.
me too,
Thanks, Christina. Any other questions?
absolutely.
If you have to hop off, Christina, that's totally fine.
Okay,
You're welcome to
I
hang on too. Oh, there she is.
alright, well,
You're on the screen. Thank
thank
you,
you all, and
Christina.
I'll talk to you soon,
Talk to you soon.
Thank you.
Bye.
bye.
Just leave that, so you can do it on there. So, I'm happy to answer any other questions, but I'm in contact with, Dr. Malay and mentioned we're on a very regular basis, texting, all the things. So, I just wanted to mention, I think sometimes when I take over for clients where I had former colleagues that were the consultant on it, I just want to make it very clear that we're a full service brokerage firm. We don't have, we're kind of agnostic when it comes to carriers, we're agnostic when it comes to solutions. The solutions that we partner with are solutions that are right for our client in the story. So if there's conversations that are happening, internally about, we'd like to explore, we've never explored this, we're constantly bringing new kind of creative things to the table. And, it's my commitment to make sure that we're monitoring this on a daily basis and watching for things that are red flags and saying, hey, we should probably take a peek into this. One thing last year, I just wanted to share, Mr. Radebaugh before his departure, I want to get the employee assistance program utilization up. I see that utilization report, I think, on a quarterly basis. Your external employee assistance program is through LUCET, L-U-C-E-T. There is a separate standalone PEPM cost that you pay. It's very, very minimal. But I would like to ensure that that continues to get publicized and marketed to employees, because in the spirit of May being Mental Health Awareness Month, we are seeing continuous results that behavioral health issues are showing up in physical claims. So it's no longer that we can say things that are going on up here aren't impacting us physically, they are. And so it's really important to emphasize that, and we've already had some conversations about that. So that's something that I'd really like to focus on, and we've got some really great plans already in the works with Cigna as well too, with some of their programming. There's a great women's health app, I think, and you heard her say it's, I think, 74% female population here. It's a program designed just for women during pregnancy, perimenopause, menopause, all phases of our life. Yes. And so I'd love to start marketing that. It's called Visanya. And then there's a great musculoskeletal at-home free program. They send you free equipment, and it's for back and joint health. And when we're seeing these musculoskeletal things pop up, we're like, let's promote the musculoskeletal programs for sure. So I've got my top 3 that I'm like programming that's already embedded in Cigna, we need to get going on it. So my colleague Sonia just sent over, yeah, go ahead.
Oh, no, I was just gonna share, I apologize, I had to set out, working on some things, but the relationship we're having, we're sending things now every 2 weeks, like we're sending did you know type things to our employees, because we're just large enough to be able to have them, but we're small enough that they can really help us, and she's constantly, it's about the relationship, working to a yes, and so we're sending things out every couple of weeks to allow members, but it keeps your rates down, like if we stay on top of it, so she's running with these things, we're gonna send out to employees to try to get them to think about things, and so anyway, I just can't say enough good things about this relationship,
Thank you, the partnership's been fantastic.
it's really good.
I echo the same sentiment, so thank you for the partnership. I think I probably talked to you all long enough, but does anybody else have any other questions before I?
Any other questions?
I have two quick ones.
Sure.
So when is the timeline for us to decide whether we want to have you farm us out or not?
So we would, last year, first year renewals always come later than we want, and it came early October.
So when will it be this year?
We're gonna push for at some point in September, for sure. When I get back to the office, actually, Kayla, who's my Cigna partner, we probably get quite annoying to them because we're always asking way far in advance. So I will let her know that I'm gonna be requesting this as far in advance as possible. But we're not gonna be in October this year, so I would say worst case scenario is like mid-September.
So that's the time that we will choose what we wanna do for next year.
So when we get the renewal, once we have the renewal, then we can compile what we send out to the carriers for marketing. If you all already are thinking, let's just market it, then we'll just do that. We'll just take, unless we get, a decrease or something to that extent that's like, well, why would we wanna change?
Yeah.
We'll be in constant communication through Dr. Millett, and make sure that, you all give me the green light on moving forward with marketing. And then my team just goes into overdrive of getting quotes as quickly as possible, spreadsheeting it all, and then we'll come and present it and show the options.
I feel like where we're at fiscally, we probably do need to market it just to show it as some responsibility.
Understood.
We have employees, my other question is, I'm gonna ask it later because it's kind of a personal thing, but it's about Medicare. I'm like, when our employees are eligible, shouldn't we educate them to move off and move to Medicare? Wouldn't that save us money? So we'll talk about that later.
Cigna can be our supplement.
So, the
You can
Medicare,
So she
encourage
can-
that, but that incurs a cost for the employee then. I mean, right now, they may be getting free insurance, or if they go Medicare, they have to pay.
It's a really great
We always
point.
encourage that, but the reason they don't go off it, like me, would be because of the cost. I'd have to start paying for month.
Right. Well, it depends on which Medicare plan you get, because my husband doesn't pay anything for his.
I don't pay anything.
You got the wrong, you're looking at the wrong plan. But I know friends that work in the district that thought they had to go to Medicare at 65. So it's something we need to learn about and educate, because it might save all of us, employees and the district.
What we could do, we could just put together, a pre-made communication piece that Human Resources has readily available for anyone that's approaching that age. That basically just says, the bare bones of like, you're eligible, you're gonna be receiving lots of things in the mail, talk
Here's the
about,
pros and cons, yeah.
and even just letting people know that in this room, yes, of course it saves the district money if they're coming along with the plan. But to your point, if you have a $0 plan, we always say when there's a $0 plan, if there's a free meal, people will take it, right? If you have to pay $10 per month, I'm gonna think about it a little more. So last year we did have, myself and Mr. Radwell had a lot of conversations about, do we just introduce, a very minimal $10 a month on the employee only $0 cost plan? And I calculated the savings of what that and I just assumed some migration to other plans, and I did just a projected anticipated cost saving. We can do all those exercises again this year. I'm not sure what the board's appetite is to kind of do that, because I understand the $0 cost is a big selling point. So anyway, I could talk for days.
So we don't have to offer that.
Could you tell them what we're doing the last week of school? I know it's later, but we want this thing.
I gave them just a little
Okay.
teaser, but I wanted to make sure that was okay to share that. So on the 26th, my colleague who's responsible for engagement, wellness, and communications is gonna come on site a couple hours at each one of the schools And, she's bringing her brown tablecloth and she's gonna set up with some benefit guides, just, did you remember you have this? It was, I think, the idea was kind of born out of the spirit of Mental Health Awareness Month. But I told her, please be prepared to talk about this Anya, please be prepared to talk about the MSK program, please be prepared to talk about the concierge program with Cigna. And so she's just gonna be available and they're gonna market it out, and I don't know if did we decide on the raffle?
Yeah, we're.
Okay, no worries. We wanna make it so that people wanna come and chat with her. She's very lively and engaging, hence her title. And she's a rock star and knows everything and anything about the district's plans. So, we're doing that, and then, she's the one responsible for making those, did you know, easy peasy, just shoot them out through email. They're gonna be on a variety of things, the EAP, the virtual visits, the programs that I mentioned was saying, even dental stuff. We're gonna take it across the board, the did you knows, because benefits shouldn't just be talked about at open enrollment.
Well, summer's gonna come on, and we saw some things, some outliers and pieces, like, why did they go to the emergency room for that? Like, you see some, it's like, it's just little things to make sure we're letting employees know, because we're not gonna see them for a few months.
Yeah.
And, or she's gonna have a little food, that's that $25,000 to questions and answers to kind of clear some things up. If we can clear up across the district, seriously, 12 people
Absolutely.
that are kind of off targets, like, wait, I don't think they realize this service, or they should be doing this. That's what we're trying to do before summer to get it. It'll make our numbers as proactive.
Those little things really, you don't even realize how much they move the needle.
Well, in the past, we've always been kind of a risky district to insure because everybody was like taking the time off.
Sure.
Nobody goes to the doctor,
This
nobody
is
goes.
waves, claims come in waves.
Because we don't have a doctor, we don't have this, so that's why we got the health department, but then nobody had any way to go there. They couldn't drive, so it's, and everything is out of area
Yeah.
because we don't
can
have
see
anything in
that
our
too.
area.
Yeah, we can see that.
And I'm really east, so I have to go Palm Beach while the majority of these people go the other way, so. Yeah, I'm 35 miles from here.
Mr. Grosset has a
Is there a
question.
cost for the board to go take everything out to bid?
No.
No cost.
You mean for us to market the coverages and get quotes and everything?
Right.
No, that's included in our broker services, that's literally one of the best things that we do.
We don't wanna spend any money we don't have to.
Well, the
That's the name
average,
of the game.
the average person, including my husband and our employees, have Blue Cross Blue Shield. And then whenever I had a fall and I had to go to the neurological chiropractor and thing, in the end, they were sending me bills like every 3 months for over thousands of dollars, and I was like, what's going on? And she went through what Blue Cross Blue Shield actually paid, and in the end, how it cost them $13 for them to accept a Blue, and Cigna is the complete opposite. Cigna pays about $60 out of the $100 for me to go. So Cigna has been a miracle for me.
Great feedback, thank you.
Cigna covers a lot of the things, like, they cover chiropractic, they cover acupuncture.
Yeah, some of the alternative kind of.
They cover, all the alternative stuff, they're really open-minded to it. Blue Cross Blue Shield isn't.
All right, well, thank you so much for your
Thank you
time
so much.
and,
I appreciate all
making
of
the
your
trip up here and
It's my pleasure.
She's offered to come as needed.
Yeah.
I know, Mr. Lucky and I talked last night about some things, I hope your questions all got answered, but I just can't share enough the relationship. I know it's something with our smallness, but sometimes small can get overlooked, and I feel very important. When I talk with them, like, we can do this, we can do that, so we're meeting regularly, and we'll brief you as you need it.
Thank you, thanks everyone.
once again, thank you so much.
Appreciate your time.
Have a safe trip.
Thank you so much, and talk soon.
Okay, board, we'll move on to the next agenda item, which is the general public comments, item number 9.1. Seeing none, we will move to the superintendent's report. Do we have a superintendent's report?
I have two things. One is, of course, you're stuck with me because our superintendent, she had
An episode.
an episode. Yeah, she couldn't be with us today. But I just want to point that out, but, also, the charter school has sent me a new contract for their charter school contract, and they're requesting that we extend their current 10-year contract to a 15-year contract. And they want to do that because, as they are a, school of, what is that called?
Are you talking about Penny
Maybe, yeah, yes.
Okay.
I'm sorry about that. They are
School of Excellence?
a high performing charter school. That we could do that. That would extend their contract from 2029 to 2034. Which I told Tracy we need to talk to our attorney about that first, but I just want to kind of bring that up to you, see if that was on your mind.
They don't ever ask us for anything.
And really, within the charter school contract, you can have it between 5 and 15 years. You know, our one that's coming on board since they were first starting with us, we're gonna use like what we did with Indiana and do a 5-year contract, that's what we're talking about right now. But, I think they're just looking ahead so that they can take care of it, so just let me know about that. That's all I got.
Is that the least amount of years we can do with the one coming up? I don't think we should go for more than a year at a time in the beginning, just to make sure.
Least amount's 5 years,
Least amount is 5 years. Wow.
charter contract. I mean, but if they break the contract, then they can be released.
I did notice that they have advertised on Facebook. Did anybody else see that? The new charter school had a blurb on Facebook with contact information if you were interested in enrolling or whatever. And they listed, I believe it's that facility over across the street as their address. Just for information.
So, Dr. Malay really has done the bulk of the work working with the new charter school. But him and I have gotten together and we have designed a charter school contract from the Florida contract model. And we will probably be giving that to
This next month, this next board meeting.
well, we'll be giving it to the
Yes.
charter school people very soon, so they can look it over if there's any changes. There's only a few items in there they can change, you know, like it would be that they will or will not pay into the Florida retirement system. Just really a couple little
Some things about transportation, some things about food service.
That's all in the contract.
Mhm.
Yeah, but I mean, there's not a whole lot of changes they can make to that. But, so we'll probably be bringing that to the board May 21st if we can.
Anything else? All right, board member comments and business, we'll start with Ms. Drake.
Well, I'm gonna throw it back to Mr. Gressett. Dr. Barfield said she was gonna bring up the ball field issue. Do you have any information
What's
for us on that?
what issue?
That it's being talked about that that we're trying to sell it.
I have no information that we are in selling it. I know that at one time, it was just talked to, I know Dr. Barfield talked to the mayor about the possibility of ever doing that, but it hasn't gone any farther than
Okay.
Yeah.
So it's strictly, because I know we've talked informally a little bit about it, but maybe we just need to make the public aware that it's not on the market. It's not currently on the market.
that. No, it is not on the market as far as I'm concerned. And
Okay.
when we found out about this financial situation, we were kind of looking at all options.
Yeah.
And that's always could be an option, but I don't think that we are really, I know that we are not pursuing that option.
Okay. I just want the public to be aware of that because we were gonna sell it to the city and then now there's a secondary buyer supposedly, so I just want to squelch the rumor. It's not on the market.
That's a definite rumor.
Okay, I had, if someone, Carla, maybe if you could talk to Mr. McKinley for us and find out about the impact fee and the house set sales tax. Can we, as school board members, campaign in favor of those or against, I guess if we were, but, at the upcoming political rallies that will be held this summer, because I think as a board, if we want them to pass, we need to do as much of that as we can, because those are, the impact fee is, the county determines that, but the house cent sales tax would need voter approval. And we need to know what our legality, can we go out and tell people, hey, vote for this?
Also the flexible funding, we need to campaign. for that.
Yes, thank you, and ask them about that one too, can we publicly campaign for that?
Because that's easily misunderstood.
Yes,
People think we're raising their taxes and
Yes.
it doesn't.
yes, we need to, that would be a great thing to clarify, and then the reason that we're asking for the half cent sales tax. We need to, I know we maybe can't spend money doing it, but can we just go to the rallies and talk about it?
We've actually had the house cent sales tax probably 2 times prior while I've been on the school board. And then we've given it up whenever we had like mission accomplished, but we have had it in the past.
I didn't
Yes.
see that
Yeah.
in there, okay. I wanted to ask Dan about Medicaid progress.
Well, I would like to introduce you to a young lady in Kristen Horn, because she is now the rock star for Medicaid,
Do
and
you know how many hands that's gone through since I've been sitting here?
yes, ma'am, but I have not watched mine.
10 or 12, because nobody wants it.
Actually, if she's welcome to make some comments, she has gotten a long ways, much further than I did.
Okay, she got a check for us.
So there is a,
Thank you,
Right
Kristen,
here.
I couldn't see you.
sorry, there is a problem with how the previous person did the enrollment.
Okay,
So-
Kristen, all due respect, I've heard that
Well, I've now figured.
100 times.
I've now figured that piece out and I'm working with the enrollment department. I've sent over the documentation saying that I'm going to be monitoring it.
Well, don't give
Dr.
them yours.
Belay sent us a
We're
document.
working on it.
Don't give them your personal stuff.
No, I will not do that. I mean, it was to the point where I said, let's just hand that enrollment and start over. And the guy said, if you start over, it's gonna take months to even get an approval. It's better to fully remove her. What the problem was, is there's the initial enrollment and then there's the request for admin into the portal. So everybody had been doing this request for admin into the portal, not requesting the change of enrollment administrator. So that is where I'm at. I'm supposed to meet with them tomorrow. I call every day. It is escalated. And I mean, I sat down with them, we went over all the 7 codes. I have 7 or 8 pages of notes. I have all different people from the state assisting me to get this done. There is an issue with one of our codes that the application she did not complete. So I'm looking to concurrently get into the portal, become the administrator, and complete the application all around the same time. So I do feel good about it, and I think having these long face-to-face meetings with people from the state that oversee the Medicaid program, not to say you didn't understand, but
I didn't understand.
I don't think the people that kind of took it over understood the therapy codes and how it
There's a
builds
lot
and how, there's a lot to it, and I was like, well, I kind of do get that. So I do feel like very soon there will be some movement in the billing, and our therapists are billing. So it's just not making it from the MTS portal 2.0 to the admin claiming portal. So they've been doing that, but we can go back a year, I can sit with you and show you all my notes and all the stuff. It is gonna happen, it's just, I've only had it for 2 weeks, and I feel like in 2 weeks I've made great progress to figure it out.
I'm committed with us, we've met some of them, like
Yes.
whatever, I know how you feel, and we're gonna see this through, because every district I've been in, we've had it. It is complicated, but it's like, we're gonna get this through.
We're gonna get it,
This was a new barrier we never got through that you're getting through now, like, we
yes,
figured some things out, so.
yes.
Okay, well, I'm gonna be gone in the end of October, and I'm gonna quit bringing it up, but I'm gonna, one of my
Keep bringing it up, we're gonna be on
You
it.
can call anytime if
I
you want an
hope one of my
update.
colleagues will pick it up, because since I was elected, almost 8 years ago, we've been trying to collect on Medicaid.
Well, and,
And we haven't, we've gotten $14 so far that I've
Well,
spent
and
on
here's-
financial report.
here's the other thing that I'm very, very excited about, is they've now opened it up they've now opened it up for, behavior. So our social workers, our school counselors, our RBTs, our BCBAs, our school sites, all of that can bill. My previous, official capacity as staffing specialist, I can go back and retroactively bill because I sat in every single IEP last year. So we actually have the capacity now, as soon as I can get into the vault,
Yeah.
to increase our, billing because we can cover more people.
And it sounds like when you get there, it's gonna be a lot of work for people to go in and put in year-old information. I mean, I can see that as a lot of data entry, that's gonna require a lot of time.
So
So
they,
when you get there, Kristen, let Dr. Malek
Oh.
know that you need some people to help you or whatever. Don't let it stall because
Right.
you don't have time to input all that.
well, she did tell me, I met with Mrs. English from the state, she oversees the program. And she did tell me that once I get in and I can get it going, they will support giving us the funding for a secretary that focuses solely on that. So I just gotta get in and get it changed, and
We're on a hiring freeze, you know. so-
no, it is their,
Well, there can't be any reimburse or all
no,
that.
it is that they will cover that salary.
They have to pay this.
But we have to get it going, so.
Right, I hear you. I'm just gonna keep on until October and then somebody else is gonna bug you on it.
It's okay, you can
Okay.
bug me.
All right, the next issue I have is the IRS. Where are we at on that situation?
Okay, I'm doing that. I have got to get some more information from payroll because when I talked to, it was like a week and a half ago, I talked to them and I walked through, I got somebody who's like very helpful. And I walked through and told him what we'd done and he had said that it was sent to the wrong place and it kind of died there and then, I guess somebody, the senator's office opened it up and they he talked a little bit about that, and he said, the information that we've given is kind of weak, is what he was saying. He says we need to get some backup to that and resubmit it to the original place that it came from. He says we really need to make that very strong, because if they knock it down again where it was supposed to go to, then we need to get a tax attorney. And then, those are a lot of money. So I've been trying, I've got to get some information from payroll. I'm trying to get some information to show them myself, I got that form, and show them that it was printed on that date and all that. So it gives us more background. Payroll has been, payroll's one. They've been working on getting our stuff for the financial board. They're also trying to do payroll, and we're about going into doing a lot of payrolls because we're going to the end of the year, and that's nothing kind of brings that, but we have people that need, so. I haven't asked for what I need from her, because I'm trying to get help just where we can go, and hopefully in the next couple weeks, I can get what information I need from her, and then we can go forward. Because I don't wanna do it
Halfway.
week, and I wanna make sure it's done right.
When you say you can go retroactive a year, is that a calendar year in January or a school year?
The month, you have 2 years, I guess, from the time that they take the money from you.
Because we had 400 more students last year, that's what I'm saying.
Well, this one on the IRS is because of the 1095 form wasn't uploaded.
It has nothing to do with students.
Students.
It's a
Yeah.
form that we should have submitted that we neglected to upload at the proper time.
And we gave it to everybody, and that was back in 2020, it was right after, with all the COVID stuff.
I was talking
And if
about
somebody
that.
knew in the, I guess, little payroll department, they did not, you're supposed to check a box, and when you do that on Skyward, it sends it to IRS.
And they should have said, hey, Glades County, you didn't submit, you're late, where's your
Correct.
forms? You know, I feel like it's just as much. And supposedly, put this in your letter, there was no communication from IRS.
Well,
Or if there were,
they told me they did do, communication in 2022.
and who did it go to?
We have no idea. And I asked them about the address, and they told me the address, and then the school is like, we've got a really weird name for Glades County School District. It's like, it's pub, instruction, it's weird. And so I started wondering, well, we had new people then, did they not realize that was ours and that somebody should have opened it, or did they just look at it and? So now in our mailroom, it says if you get anything from this people, to bring it
IRS, I mean,
well,
they
yeah, we would have thought so, but it was to a weird name, so did somebody just, because we had all new people.
Yeah.
So did somebody just throw that away? I don't.
Because I don't think they do what they did to us without notifying you first and giving you an opportunity to fix it.
Well, that's what he was saying, he said, I can see in 2022 they said something, in 2023 they said something.
So I know a retired accountant, CPA, who might take this on as a pro bono case for us. So if you get to the point where you want that, but he would have to talk to you and let you explain it to him, and then him knowing and having relationships with the IRS, he may be able to, I don't know. I was gonna ask him for his help if you don't get anywhere, because that's a lot of money for us to just forget about, you
Is
know?
that an error or an omission?
Yeah. That's an error and omission right there.
Yeah, so
Absolutely, that is. Maybe that could be added to our claim.
Maybe we can look at that. I have to learn more. I know she's been championing that, so.
That's an excellent idea. Because that really was, someone just didn't upload a form.
And I don't know where all
This
that'll
one
go.
guy took me 5 hours.
Yeah, I know, I've been on hold with them for a full day. So I just, and the special facilities analysis by Wiseman, do we have that yet?
Special facility, no, it's not completed.
Okay. Taking a long time.
Well, that's probably because they're working on it throughout, but they won't probably have a final figure until we're done.
I thought they were gonna analyze where we were and show us how much we had left.
We were going to, we were in a contract with someone to do that, and we decided not to do that.
Oh, I thought they were gonna do it.
Well, they're doing their own internal, but it'll be for the whole thing, so that.
So we can't see that, like see where we're at on that?
I can ask John, he's actually here, he's actually in the break room.
Okay, great.
No, he's here for our 11 o'clock meeting.
There's a weird thing that happens with our phone, I've reported it before, I don't know who to tell it to, but when you call and ask for Amber and you get Amber's extension, it gets you Janice Foster at the high school. And it's been that way for about a year.
Did you
I
hear
don't know
that?
who's in charge of the phone, but
So, well, that would be Amber.
that's Amber's
I mean, it's
extension.
not, but, I
Amber's
mean,
extension number, someone transferred me there and I got Janice Foster picked up at Moravian High School and she's been gone a long time.
and she still picked up.
Her voice failed.
Will you check on
You're
that?
right.
She's checking on that.
So now about food service, do you have any updates on food service balances or where we're at on food service? I know the emergency board was asking about it, I've been asking about it, is there anything we can see since what? Because the information Mr. Rayfall gave us was only a la carte. So that we don't have any idea where we're at on food service.
We spent the last week working on that. We found numerous places in Skyward where there have been, situations such as, an item was paid for with a grant, such as the No Kid Hungry grant, that costs, for example, $64,000. We paid for it out of the food services stream, and when the money was pulled down, it was put back into the general budget. So it looks as if there's a $64,000 deficit in food services. We found something similar to that several times. It was either money that was put in the wrong place, or the money wasn't pulled down at all. And then we found that quite a bit of times for 24-25.
So that answers the mystery, right? That's
A
where
significant
why food
portion of it.
service was in the deficit.
It shows a significant portion of it, and I mean, we're still looking, but that, if you could just see the frustration on some of their faces, just looking through the food services stream, there's some significant goof ups that are hard to explain.
Wasn't there a salary that was put into food service that wasn't
A couple of salary questions.
Well, I feel like not only this board needs to know about, it sounded like the emergency board wants to see that food service breakdown, so someone needs to,
I'm not sure exactly how you would show it to them,
Well, they're digging,
they're digging.
they're getting there in everything. The only reason I say this is because like with HR, we coordinate all departments and we're running into things and, you know, cleaning things up. So as they just kind of going school by school and then they'll pull in, like custodial, how we have it. Well, I mean, they're looking at all of it, so I have no doubt they're gonna be with us for a while. I already see kind of how this process is working, so I do feel like it's gonna get that scrutiny. They're getting there. We meet again, this week. Tomorrow.
the only other thing I have written down is can we negotiate our power costs? Because when you look at our warrant register, it's been that way. And I don't know if that's something the emergency board can maybe help us with, but our power costs are so exuberant. And I feel like we're probably the biggest customer. I know we are for locally, but probably not with FP&L, but I think those are negotiable for big customers. You know, energy per watt, per kilowatt. I think it's something we should look at.
I've asked that a whole bunch in the past, Crystal.
I
And
have
we
to
didn't,
look at it.
we didn't have a choice on who our carrier is or was, but I think that we do have a choice now. I think FPL is actually local, are they not, or is it still Bates Co-op?
We pay the city, it's co-op, yeah.
But we have FPL at West Lakes.
At Westwood.
Yeah, so
And
we have two,
is FPL available in Morehead
I don't think so.
if you change carrier?
I
No?
don't think so.
Okay.
But I think you can negotiate if you're a big customer, right? Which I guess if there's no competition, you can't.
Well, and I think a lot of money can be saved on electricity, I think Dan will agree too. There have been companies that have come in to pay them to try and do things like, you know, change out our lights, start putting set points for air conditioning. There are some schools, you know, like the high school, that they have a system that we just need to update. But there are some classrooms, it gets to be 69, 70 degrees in there, and while other classrooms are set at 74, or most schools set between 74 and 77. That's usually the range. And when you're running 69, 70 degrees all day long, all weekend long, I mean, your bill just goes up and up and up. So there's,
So is
don't we have some of
that
them in place
Dan's
already?
I have started that
project?
project.
Did you see what we paid this
Yes, ma'am, I have. I'll tell you, there's lots going on here. Trying to understand the bill from the city of Morehaven for our water and electric is really bizarre. It's not consistent. And I need to sit down with somebody over there and just go through literally months and months of bills and ask them, explain why this says this. It looks like we're getting billed for water at an exorbitant amount, and then electricity is darn near free one month, and then the next month it's flipped. I believe that there is certainly clerical errors going on there, potentially misreadings. But I'll tell you, what Mr. Gressett said is true. We do need to do energy audits to all of our buildings. I'll tell you something else, repairing the AC systems at both schools that we've been talking about, high school and Westlake, will have a tremendous improvement on, our energy savings. There's lots to do. We wanna switch to LED lighting. We need to come up with a plan for that. We're working on that.
Didn't Sam already do that on it?
He did it, but it's theirs. They only did it to encourage us to go with them. And we are privy to it to some degree, I mean, but it is their audit, not ours.
So Morehaven, City of Morehaven was $32,328.17. Now that's two schools.
The district office
Right.
and the bus barn.
Right. It's really all four campuses is what I call them.
Yeah.
What month was that? March?
Check was, oh, I'm looking at something totally. I'm looking at July 2025, I'm sorry. Okay.
Well, we should see a moderate drop in the usage for the elementary school because the new building is far more efficient.
Correct.
So we're gonna see something happen there.
Okay, I don't wanna prolong the conversation. I just think that's something we need to do, if we can. I'm done.
Ms. Clement?
I do, I've had several people contact me about the online meetings being published, that the March 12th meeting wasn't on there, and they wanted to ask when that would be published. Our school calendar, we did vote on that, as well as making sure that we get that out to all the families so that they can plan for next year. They said they looked on their calendar, on their website, it wasn't there, but also our VPK, was it VPK, it was kindergarten orientation, there were several parents that were not aware there was gonna be an extra week in the school calendar next year during October. I just wanna make sure that we are getting that information out to the families that there is gonna be an extra week on your school calendar for next year to plan for childcare, whatever the case may be. You answered all the school zones, you checked off a lot of the questions I had. A huge concern, parents have asked, and I've told them, the district's told them, that they would be waiting for this meeting on VPK. Can somebody give us our update on next year's VPK classes?
So we are going to move towards the ESC pre-K model. Early Learning Coalition does wanna come and meet with Mrs. Mullins and I next Thursday to see if there is something they can do. But at this time, it is my understanding, and I might have missed something because I wasn't in any of the last meetings, that there isn't at this time an agreed upon VPK contract or enrollment plan.
Is that what we're finalized on and moving with? There's just been parents that are trying to,
I believe
teachers that
so,
are,
because you non-renewed the pre-K teachers that were regular.
Yeah, we're moving just for ESE.
Just for ESC.
well, we did non-renew one of the ESE teachers, or that would leave them with nothing there.
Yeah.
So
But-
I'm just wanting to make sure parents that are asking about VPK next year, the district office has told them wait till May 7th meeting. And we didn't have that on our agenda, so I wanna make sure that it's very clear. Are we making that announcement today, whether we're having VPK classes for next year, or is it only ESE?
We talked
It
about
is
that this
only
morning.
ESE.
As far as right
And-
now, it's only ESE.
It is only ESC, and the personnel decision at that school is strictly with administration, it's not because of anything here. So, I don't even know what that choice was, so,
Okay, I just wanna make sure we have an answer for the parents that are asking, who have been waiting to sign up elsewhere, they were waiting to sign up here if that was gonna be an option.
I will say, in my discussions with the schools, I have said, if there are concerns or if they feel like they want to try different paths, don't let them stop what they're doing, right? And they can also reach out to, Early Steps as well as Fiddlers. So that has been what I have asked for them to say to parents that are calling, because we simply were not quite sure yet.
Plus, they can always go to the Early Coalition website and ask for the voucher, get that voucher asked for, and then later on, they can take that voucher to where they can find a place. So they need to go online, get the voucher. You don't have to say where you're going, just get the voucher, because that's what you have to take to the school.
When we're telling them to call the district office, everyone was told to wait till today's decision. And now, are we gonna communicate to go online to that Early Learning Coalition to,
That's always
That's
been our
our voucher.
the schools, that's what they're saying.
That has to be posted.
okay,
We have to post that. But if in the future, if there's a decision where VPK is solely for exactly what ELC covers, which is October to April, 3 hours a day, Mrs. Mullins and I have done all the mandated requirements for that already. So,
last meeting, we signed that paper just in case we
Just in
decided this
case.
meeting to have it.
and then we had to attend like a Zoom call with the people over the program. We did that the other night.
Could I comment? I don't want to interrupt Chair, I just wanna make sure I understand. So we did talk about it. I just went back in our minutes to double check. We did not take action on that. I don't know, were we supposed to have taken action on that? Were we gonna take action this meeting?
We were gonna take action this week.
Well, we took the action that we'll have it, and then we'll see if we even have it, because we have to be ready to have it if we have applicants.
But this is the thing, if we're gonna open it up for applicants or not. At this point,
I think at this point, we've let the superintendent decide we're not gonna have pre-K, right?
Correct.
And the board has not taken action on that. So the question is, does the board have to take, wanna take, need to take? I don't know. Is that the superintendent's call to decide that?
I don't know if that's
We had
the
to offer.
superintendent's call.
Okay,
It's
so
just
we're
like-
eliminating a program.
Yeah, I mean, it's just like if we're gonna add a nursing program at Westlake School, that's not, we don't vote on that, that's an administrator.
Okay.
The only thing that you have to offer by law is the ESE.
Right.
The other's just extra, and it's, so we're offering only by law, and
the communication was just muddy, so I'm
Gotcha.
trying to make it
Gotcha.
crystal clear.
Yeah.
Okay.
if we can.
Alrighty, May 12th is our pre-K through 12th grade talent show in Moorhaven, and it's opened up to all Blaze County, students. I believe it's at 6 o'clock, and that is also the 4-H banquet, so May 12th, if you are able to attend that event, it's gonna be extremely awesome. Our kids are very talented, they asked me to be a judge a couple years ago for that event, and I was sitting there trying to hold back my tears at how amazingly talented these kids are. There is information going out about that. Ms. Carla, if you get that flyer, can you send it to our?
For the town show?
Yes, ma'am.
It's on your calendar on your, Blaze School District, that's on there.
I'm just excited about that. I won't be able to go because I do have the 4-H banquet, but I am very excited to see that. This week and past week, we had several appreciation days for our principals, vice principals, the lunchroom staff, our teachers. I cannot express to you how amazing these individuals are and our appreciation for each and every one of them. We don't get to tell you enough how, just something simple that you're doing, a simple thank you doesn't seem like enough, but on their end, they don't get that thank you enough, that we really do appreciate you. I know that our district has been through waves. Somebody the other day kind of explained it as a recession, and whenever recessions happen, you get through them. But I want to say thank you so much from the janitors, to the bus drivers, to the teachers, every single employee in this district. If you were not able to get a sandwich from us and some chips and whatever it was that we said thank you, that is just a very small token of our appreciation that we sent out to everyone this week, right? I just want to say thank you for everything you're doing and you continue to do, waking up every morning and choosing Blaze County. So I just wanted to say thank you, and you are greatly appreciated. I think that's all I have.
Ms. Pierce?
I just know things get busy, coming to the end of the year and people are testing and everything else. I'm just sending my prayers up for a good ending of the school year for everybody.
Mr. Lucky?
I just have a question. Why are we allowed to have a 178-day school year? Is that is that all districts, 178?
No, it depends on number of minutes. We meet the minute requirement, or two for credits and for just the minimum requirements.
And there's not gonna be an issue with the short semester for secondary students?
There will be if there's a hurricane. When the voting for that went out, I made sure that they knew about that.
That's why makeup will be in the semester in which the event occurs, so. I just needed that clarification. I don't have anything.
Okay, I don't have anything. That's why I go last, so that everybody else covers my issues and I can say I don't have anything, right? So with that, I will adjourn the meeting. Thank you very much, everybody.
progress